Welcome to another edition of the Health Insurance Store webcast podcast. We recently did make the transition to webcast from podcasts. My friend Steve, who has been walking me through this, I turned and looked at him. He's supervising today, so if I get a little nervous, it's because I got a guy watching me over here. But Steve Barber from Unit 4 Media is getting me all set up in the 21st century here. With all this latest technology. So bear with me, guys, because I got a face for radio. I get it. So if you don't want to see me, you can just listen to the audio and not watch the video. And we're going to talk about how you can subscribe to webcasts and podcasts here at the end of the show. For those who haven't tuned in before, my name is Aaron Zolbrad. I'm the president and founder of the Health Insurance Store, LLC. We've been around. We just celebrated our 13-year anniversary in April. What we do is we do all things health insurance. We're here today to talk about Medicare, but we do individual health insurance. If you're a small business owner, we do group of health insurance. If you own a business and want to provide benefits to your employees, which I think is a great idea. And really our bread and butter for the 13 years since 2008 has been Medicare. And that's what we're going to talk about. And that's what a lot of our webcasts focus on. Again, for those of you who also don't know this, I do a column every Friday in the Post-Gazette. It's called Ask the Medicare Specialist. It runs Friday on page A2 in the Post-Gazette and Tuesdays on page A7 in the Trib. And what we've been doing is we've been doing webcasts or podcasts, and we review the question we received. And that's what we do. We get a question from somebody in the community. We answer that question in the paper, but I'm limited on space there. So what we've been doing is we've been going over those weekly questions in the webcast or podcast. And so that's what we're going to do today. If you'd like to get a hold of us via phone, if you have questions, 724-603-3403. The website is www.getyourbestplan.com. You can also follow us on Facebook. Just type in the Health Insurance Store, and you can find all of our stuff on either Facebook or our webpage, our podcasts, our webcasts. You can get quotes. You can ask for an agent to come see you. But let's get into the question that we got. It's from Randy. And his question was, I recently went on Medicare for the first time and chose a zero premium HMO Advantage Plan. Did I make the right choice? So my answer is this. Number one, there are several $0 Advantage Plan options, and virtually every company has one offering. And they're not all created equal. So you can find probably 6, 7, 8 zero premium plans. We're going to talk about how the heck can I get a zero premium plan? That's a question everybody has. We're going to talk about that. And what I'm telling Randy is, without knowing what company or plan he chose, I wouldn't be able to answer that question definitively. But I'm going to present some questions, put forth some scenarios, and give some examples of groups who I feel may possibly make an error when choosing a Medicare Advantage plan, not just zero plans. Because there's about 60 Medicare Advantage plans on the market to choose from. Some are $0, some are in the $20 range, some are in the $50 range. There's actually Advantage plans that cost as much as $300 a month. So we're talking about 60 plans from all points in between $0 and $300. So I would have to look at your plan to know if you made the right decision or not. But trust me, plenty of people make poor decisions when it comes to choosing a Medicare plan. Now, here's the thing. Before Randy decided on making this choice that he spoke of, was he given the supplement option, the Medicare supplement option? So do you know the difference between Medicare Advantage plans and supplements? So the biggest error that people make and the biggest misunderstanding for seniors when they're choosing an Advantage plan is they don't know the difference between a Medicare supplement and a Medicare Advantage option that Randy took. So Medicare supplements are also known as Medigap policies, and that's exactly what they do. You have original Medicare, which basically covers 80% of your bills, and you buy a supplement to come in and cover that other 20%. What Randy did was he chose an HMO, an Advantage Plan HMO, which basically replaces Medicare, or he's chosen a plan that pays in place of Medicare. Now, Randy doesn't show his Medicare card when he goes to a doctor or hospital or lab. He shows his HMO card from a private company, and there's 7 entities that do that in Western Pennsylvania. And folks, I have to be careful. I'm not allowed to say companies' names when it comes to Medicare Advantage plans. It's a really strange restriction that they put on us agents. I can talk about supplement companies. I can't talk about Medicare Advantage plan companies. I don't know. It's just a rule. So bear with me when I say I can't mention those companies. So he chose to basically I'm not really supposed to say replace it, but again, he chose a private company to pay in place of Medicare. Now what happens is Medicare, instead of paying 80% of his bills, Medicare is going to pay the private company he chose $800 a month to become his one and only insurance company. And that is why he can pay $0, because the insurance company received $800 from a third party. So what Randy did is he chose a private insurance company to be his one and only insurance company. Okay, now, again, the company he chose is paying, or Medicare is paying the company he chose $800 a month to become his one and only insurance company in lieu of or instead of paying 80% of his bills. And now that's the card he's going to show when he goes to a doctor, hospital, or lab. He's not going to carry his Medicare card. He's not going to show it anymore. And again, did he make the right choice? I don't know. I'd have to talk to him. We're gonna get into that in a minute. I will tell you, and I'm going to go over this again, I like the idea of taking the low premium plan. If you're going to take a Medicare Advantage plan, we advise our clients to take them in no more than $60 a month. So as far as the premium he chose, yes, but as far as he chose the right plan, they're not all created equal, even plans that have the same premium. Again, so we're going to go over that. But our number one goal with new clients is making sure they fully understand both Advantage plans and supplements, because there's a huge difference. There's a difference in monthly premiums. There's a difference in out-of-pocket exposure to medical bills. There's a difference in access to doctors and hospitals. There's a difference on how claims are paid and approved. Again, stark contrast between those two types of plans. So again, once again, it's fine to choose an Advantage plan once you weigh both the benefits and risk they present. So when our clients want to go with an Advantage plan, again, we recommend the lower priced options, because in my opinion, that's the number one reason why you take one. So let's talk about supplements. They average about, let's call it $100 a month, okay, for somebody in their mid 60s, early 70s, around $100, $110 a month between their supplement and their prescription plan. So that's $1,200, $1,300 a month. So the whole concept of taking a low premium plan, what Randy's doing, he's taking a zero premium plan. He's saving all that money in premiums. He's saving $1,200 to $1,400 a year in premiums. Over a 5-year period, that's $5,000, $6,000, $7,000 he's going to save. And if he stays relatively healthy, he can indeed save quite a bit of money. Now, there's a flip side to that, which we're going to talk about in a minute. But again, if those people on Advantage plans stay relatively healthy, choose the right zero premium plan or right lower premium plan that has lower hospital copays and lower out-of-pocket costs, the savings over a 5-year period, again, can be $5,000, $6,000, $7,000 or more. But the key phrase is if you stay relatively healthy, because if you don't, there may not be may not be a savings for you. So again, what I would ask Randy again, did the representative or person you work with, the agent you work with, did they take into consideration your circumstances, such as your income, your overall health? Are you a veteran? Can you get VA benefits? Are you eligible for PACE or PACE-NET, which is prescription assistance for people over 65, which is a huge benefit? And all this and more can be really instrumental in choosing a plan. And this is what we talk about with our clients. We're going to interview them first. When they sit down with us, what are your goals? What do you want to do? Do you travel? Do you have a house in Florida? Do you go on vacations? Do you have kids across the country? All of that needs to come into play when we're going to help choose your plan. So can you get insurance through your employer? That's something else. Sometimes we might even tell people not to take a plan with us. Hey, we found out you've got HOP benefits because you're a retired teacher. Oh my gosh, that's the way you want to go. And you want an agent that's going to help you with that and be honest with you for that. Another thing that is very important to consider when choosing an Advantage plan is something called the MOOP. Okay, that stands for the maximum out of pocket, the MOOP. We're going to talk about that all the time. If you tune into my podcasts, the webcasts, if you read the columns, we're constantly talking about MOOP. That represents the most money you can be billed in a calendar year for your Medicare Advantage plan. So we have a super popular zero premium plan. The most popular we have, the MOOP is $3,400. In other words, that's the most you can be billed out of pocket. However, most zero premium plans, that MOOP is $6,700 out of pocket. That's double. So really, if you want to go, we try to steer our clients towards those lower MOOPs, because guess what happens? So let's say we just talked about saving $7,000 over a 5-year period, right? You took a zero premium plan, but 1 year you got cancer. God forbid you're diagnosed with cancer and you needed chemotherapy. And I guarantee you, if you need 10 chemotherapy sessions, you are going to be billed that $6,700. You're going to be billed that $6,700. So guess what happened to all that savings? It's gone. Maybe you're only 2 years into an Advantage plan. Okay, and you're thinking you're saving money, then all of a sudden you get a bill for $6,700. Guess what? You're in the hole now. And we're going to talk about another factor that once that happens, you may not be able to go back to a supplement. So again, we talked about supplements earlier. Medicare pays 80%. It's primary. Supplement comes in, fills in that gap of the 20%. That person who had that same amount of chemo who had a supplement paid $0. The person on the zero premium advantage plan who had to get that chemo, who had the same cancer, got bills for up to $6,700. So that is a huge, huge consideration. And that is one of the biggest risks when you choose an advantage plan is, number one, how much could you be billed in the event that you had cancer? You needed, you stayed in a skilled nursing facility. You needed an expensive prosthetic device, which I know is rare. You needed, here's a big one that people don't, that's happening a lot. You needed drugs infused, Remicade. It's a infusion medication people are taking with severe rheumatoid arthritis or Crohn's disease. It costs $400 every 4 to 6 weeks. If you have an advantage plan, it doesn't cost anything if you have a supplement. Another thing, did the person who sold you the advantage plan, I'd ask Randy this, did he compare it side by side to similar premiums from a different company? If you work with a broker, it's important to work with a broker like myself. We don't work for just one company. We work for several. We don't work for any company. We are appointed to sell plans from every competitive company on the market. So I'm not just pushing company X, where that's what happens with a lot of people. They're pushing company X because if they don't sell you a product, they don't get paid. Okay, so we want to make sure that you're comparing zero premium plan to zero premium, or maybe say, you know what, maybe it's best to spend $20 on a premium. Look, there's a lot of value in spending $40 on a premium. Maybe that's the plan we should consider because, yeah, we're spending a little more money, but we get a lower out-of-pocket maximum. Maybe we get some extra benefits like dental and stuff like that. Those are all things we want to consider. Listen, I'm throwing a lot of stuff at you out there. That's why it's so important not to just throw darts at the wall and hope you're picking the right plan or calling the company that you had your insurance with before you turned 65 and tell them you want to go on Medicare. Come sit down with us. Come sit down with me or one of our licensed agents. We're going to throw it all out there. You're going to see every plan, every company, compare them side by side, understand the difference between supplements and advantage plans, which again is the most important piece of information you can ever get. Now, we just talked about zero premiums having the highest out-of-pocket maximum at $6,700, and we also don't like our clients to go into plans that have what's called a per-day hospitalization. Okay, so HMOs or PPOs, you have a copay for a hospital, unlike supplements. We want our clients in a per-stay hospital situation. So no matter if you stay 1 day or 20 days, it's going to be a $300 or $350 copay. Where there's other companies, you could be billed $200 to $250 a day. So if you had a 4 or 5 day hospital stay, you could be looking at $1,000, almost $2,000 for the same exact stay. So we've got to pick out the right ones. Another thing, here's a big thing. Did you compare copays for prescription drugs from one plan to the next? So generic drugs can often be more expensive from plan to plan. So if you're taking 5 generic drugs on one zero premium plan, you could be spending $40 a month on those drugs, but they might all be free with another zero premium plan. $40 a month is $480 per year. What if you're on 6 drugs? That's $600 a year. So again, all of these things have to be factored in. You try to do this on your own. There's a book this thick that shows all the copays. The average person can't sift through that. That's what we're here for. We're here to pre-sift that for you. We know coming in which plans are worth looking at. We don't need to spread 60 books across the table or 60 plans across the table. There's really only 2 or 3 or 4 plans that are worth consideration when it comes to HMOs and PPOs. Supplements are very simple because they're regulated. Doesn't matter what company you buy them from. You can only buy plans labeled with letters. They're a lot easier to buy than Advantage plans are. Lastly, and this is the most important thing, this is the biggest risk of an Advantage plan. Remember I talked about one of the risks is, you could be billed $6,700 in a year. What if you were billed that $6,700 consecutive years? That's $13,400. That's a huge risk. The bigger risk, in my opinion, is, Randy, what I would ask you, the gentleman who made the question, were you made aware that if you choose an Advantage plan and you get sick or had a pre-existing condition or get sick down the road, that you can't go back to a supplement? Because Medicare supplements, unlike Advantage plans, can do what's called medically underwrite. In other words, they can discriminate. They don't have to accept you. They don't have to accept you in their plan after you've had an Advantage plan for 1 year. They don't ever have to take you back. So if you had a heart attack, if you had a stroke, if you're an insulin-dependent diabetic, if you were diagnosed with cancer, A, you may not be able to go back between 2 and 5 years, and B, if you were diagnosed with something called lymphoma, which I've had several clients who were. I just went up to Crawford County for a wedding and ran into an old friend. He was just diagnosed with that a year ago. It's a cancer that never goes away. It can go into remission, but it never goes away. He's always going to have it. You would never be able to get back to a supplement. And I have met several people who have had to take chemotherapy for the rest of their life. And they meet that out-of-pocket maximum every single year. So that's the biggest risk that you take. And was that explained to you, Randy? I hope it was, but a lot of time it isn't, especially if you call a company directly, or if you're going to work with somebody who only sells one company, they're not going to explain it to you. I bet you 95% of people who I meet for the first time either A, don't know that they didn't buy a supplement, or B, didn't know the risk they were taking that they couldn't get a supplement back that would eliminate those copays. Again, that's the number one risk, in my opinion, of taking an Advantage Plan. Now, listen, I don't want anybody to think I'm anti-Advantage Plan. I'm not. We've got probably 4,000 clients on them. All right, we've got about 10,000 clients. We've got about 40% of them on Advantage Plans. But you've got to know what those risks are before you make that decision, because a lot of the 6,000 people that are on supplements didn't want to take those risks. Okay. A couple thousand of them said, a couple thousand of our clients didn't have a choice. They couldn't get on a supplement. So we just have them on an Advantage Plan. And a couple thousand said, you know what, Aaron, I hear the risks. I'm willing to take them. Listen, if you know the risk, you're willing to take them, I'm all for Advantage Plans. We'll help you find the one that best fits your needs and budgets. If you'd like to speak with myself or another agent and get a second opinion regarding your current plan, give us a call. Many people can make a change during the middle of the year. And if you want to come have your plan compared outside of annual election period, so annual election period is the 53 days where anybody can make a choice. You're not tied into that to actually compare plans. If you want to come sit down with an agent, or you want to call us, or you want to do a Zoom meeting, I know we're still, the COVID's making a little comeback here. So if you're not comfortable coming into the office, give us a call. We can go over this stuff. We can do a Zoom meeting where you can kind of look at me just like you are right now, and we can discuss things. I can show you some other documents. It's almost like sitting across the desk. So give us a call. One thing is very important. We don't charge for consultations. I always want to make that clear. People ask me all the time, what's the cost for your services? And the answer is there are no costs for the services. We provide them. There's no cost consultations in the office, over the phone, via a Zoom meeting. Again, you can email me personally if you'd like, if you have questions, at aaron@getyourbestplan.com, aaron@getyourbestplan.com. Our website is, again, getyourbestplan.com. The phone number is 724-603-3403, 724-603-3403. I want to show you a couple things, guys, where you can subscribe to our webcasts or our podcasts. So here's our website. All you have to do is, you see we have our podcast gallery, we have our webcast gallery. If you just click your webcast gallery, and then you see the subscribe button, you can click on that subscribe button, and there it is. You can go on our webcast, you can subscribe, and then, if you want to watch at home, or you want to listen to our webcasts at home, you can do that. If you want to listen to our podcast, you just click on the podcast gallery. There you go. Oh, excuse me, that's webcast. There's our podcast gallery. And normally you would see a subscribe page right below my face. Boy, I look a lot better in that picture. I think that was taken like 4 years ago. And you can, right underneath my picture, say subscribe, and then you'll get an email sent to you every time we have a new podcast. So if you want to listen to those in your car, or again, you don't want to see my ugly face, you don't have to. So please, guys, we want you to listen to the podcast. Hope you enjoyed them. That's it for today's episode. And we're going to sign off here in a moment. And again, we hope you turn into our next one. Don't forget to every Friday, Post-Gazette, page A2. Every Tuesday, Tribune Review, A7. You can read the Ask the Medicare Specialist and then follow it up with our podcast. So thanks again for joining us, folks. We'll see you later. Stay safe. Hope to see you soon, or hope you'll watch me soon. Thanks again for joining us. Thanks for listening, folks. Join us again soon as we interview those on the front lines of healthcare, health insurance, Medicare, and our ongoing prescription drug crisis. My name is Aaron Zolbrod, and we look forward to helping you get your best plan at the health insurance store.